Hello, I'm Abby Hunter, and I'm one of the bariatric coordinators with Mid-Michigan Health's Surgical Weight Management Program. When considering bariatric surgery, it's important to understand your surgical options. Listen to one of our bariatric surgeons discuss the adjustable gastric banding option.
So first I'll talk about adjustable gastric banding. This is a picture of one of the bands here. So every band has similar components, including the band itself, which the balloon on the inside is what actually fills with saline to increase or decrease somebody's restriction. The band is then connected by a tubing to an injection port, and the middle of the injection port has what's called a septum, and that's what we have to access with a needle in order to add fluid to or take fluid out of the band. You can see on the diagram on the right-hand side here how the band looks when it's placed. It's placed on the upper part of the stomach. So what happens is it creates a virtual pouch. So that food comes down the esophagus and it will be held up by that band, and it'll have to be digested partially before it will then move on through just like it did before. So this works strictly by causing restriction or limitation of the volume of food somebody can eat. When we place the gastric band, we don't want it to slip out of place. So at the time, we will put some stitches to secure it in place. As I'll talk about a little bit later, there is a risk of the band slipping out of place. So that's what we do to try and help overcome that. The advantages, again, gastric banding is minimally invasive with small incisions. It is reversible. If needed, we could remove the band. It's adjustable. Typically a shorter hospital stay. Most patients with a gastric band are done as an outpatient or one night in the hospital. Overall quicker recovery because it is a little bit faster surgery. There's no stomach stapling, cutting, or intestinal rerouting. The gastric band does have the lowest operative complication rate. That is at the time of surgery something that could go wrong. Also has the lowest mortality rate. So if you look at everybody that had this surgery as far as having a death for any reason whatsoever, it's about 0.1% or 1 out of 1,000. Disadvantages, well, it does have a higher reoperative rate. Okay, so when this band is in place, in order to fix something, if the band were to shift out of position, if the port were to flip underneath the skin, these are things that do require surgery ultimately to fix. And so that's something you have to understand. The rate of the band slipping out of position is about 1.8%. There's also a risk of the band actually eroding into the stomach, which is about 0.6%. As they've made further and further modifications of the bands, we've seen that these rates have decreased. There is a slower initial weight loss. Again, if you refer to that excess weight loss diagram I showed you, it is less compared to the other surgeries. And absolutely critical is regular follow-up, because if we don't see you in the office, we aren't able to adjust your band to make adjustments as necessary.
If you would like to learn about other surgical weight management options, watch the videos on sleeve gastrectomy and Roux-en-Y gastric bypass.